Hi, welcome back. So this is going to be the second part of my Zoom session with Dr. Ujjwal Soni. We talk about a couple things. The first one, we talk about research, how important is research to match to internal medicine program in United States. Then Dr. Soni give us some great tips how to do well during the interview. We had fun by playing this and that trivia game. And finally, we wrap up with me give some tips for Dr. Soni's upcoming residency training. So without further ado, let's jump to the video. How much important is research to match to internal medicine, not any other specialty? Okay, I know other specialty, if you go to plastic surgery, dermatology, 100% research, you have no research, forget it. Okay, but for internal medicine, because in my days it was not that important, but these days are more competitive. Watch your videos, it is getting more competitive, even with people who have 260, 270, they have a low number of interviews. So what do you think, how important is research to match the internal medicine residency?
Well, from my personal experience, by research, let's just clarify, by research, we mean publications, right? We don't
Publications,
mean,
yes, having
right?
something
We don't
published.
mean, yeah, we don't mean any research electives for that matter. So, in my personal opinion, having, known my colleagues and my own application, I have seen, so I don't think so that it is very important. I wouldn't say it is very important. People really focus on getting a good number of publications. They don't care about the quality of the publications. They cross share the publications, publish on very low impact journals. So just to increase their number, right? Useless topics. So, and people can really make that out. They check, when they check your publications, they check your journal, and then they check the names of the co-authors, and then they see these are the same co-authors in four papers, right? They just have switched the places. So in a way that they can make out that, okay, this seems a little fishy. So I would suggest that focus on getting 2 to 3 good publications. Those could be case reports or case control or meta analysis, anything. But focus on quality rather than quantity. I have seen people with 18, 20 research matching into community programs. I just had 3 published and 5 submitted, and I submitted my application, right? And nobody really talked to me about my publications in my interviews. So yeah, I mean, similarly with my other colleagues, some had 2, some had 5. Everybody managed to match. So I don't think so. Research, you cannot leave that area blank. So you cannot leave that section blank. Try to aim 2 to 4 good quality researches, and for at least for next 1 or 2 years, that should be sufficient. Cannot comment for the upcoming years.
Of course, yeah, I understand. And then when you say good quality, would you say, I think one of the easiest ways to do systematic review for research, would that be sufficient, do you think? Or you need to do something more like a case control or cohort would be difficult?
No, I would say no. I wouldn't say case control or cohort would be expected out of medical students.
Yeah,
So I think meta-analysis or
meta-analysis, systematic
some
review.
systematic review should be good enough. Even case reports, if they're good, they should be good enough. When you're going for a US clinical experiences, you might come across some good, interesting cases, and you can request your attending if they would like you to write a case report on that. And when you go to for US clinical experiences, even you might find residents who are preparing for their fellowship applications, and they might be doing some research of some sort. So you collaborate, you ask them, you help them write their manuscript. Residents don't expect you to do data analysis. They would probably need your help in writing the manuscript, doing the review of literature. So that way, even if you have 3 to 4 quality researchers, that really, and especially with people in US who are already residents or attendings, that would really help, right?
Got it.
Yeah, that is
All
my
right.
belief. Yeah.
Cool. Now we move on to the interview part. Now it's very different. The thing is, I used to be on in-person interview. I travel, and then of course, I think it's because this is signaling. I got a lot of interviews just because of the score, and I got 13 interviews. I got 2 pre-match offer.
Great.
At that time was I would say it's much easier, So I
Mhm.
travel and then go to in person. I think this kind of really helps. Now it has been virtual since COVID, so that's a big change now. So what is your tips or recommendations to do well on the virtual interview?
That's very true, Dr. Yadi. Firstly, since the advent of virtual interviews, there is no cap on how many interviews one person can take, right? I've seen people accepting 30 to 40 interviews. So that has really resulted in disproportionate distribution of interviews to people, right? Earlier, people used to cancel their interviews because they couldn't travel so much, right? They were in person interviews. But it has become really hard, especially this year. It was competitive for some unknown reason. I don't know. Even people with very competitive profiles hardly got like 5 or 6 interviews. I personally had just 6 interviews as well. Firstly, these are virtual interviews. Get comfortable with the camera, right? You just have 15 or 30 minutes in front of a camera where you're partially visible, right? People cannot read a lot of your body language. You have just 15, 30 minutes to convince them to take you that, and you are a competitive candidate, right? So yeah, be comfortable with camera, learn how, do a lot of mock interviews, learn how to, what answers would you be answering to them, and how to sound natural, not robotic in the interviews. So a lot of these minute things would really help you. How to set up your frame, how should you, I mean, it should be 90 degrees, how should be your wall, how should you be dressed up professionally, what should be your frame. Like this frame currently is not a very good frame, your frame is good, it should be till my sternum, and so that it interviewer feels that I'm just sitting in front of him, right? A lot of these minute little details will really help you. Other than that, just practice, practice, practice. Show your answers to other people. Ask them, residents and other of your mentors, ask them if these are good answers. Because a lot of time, because you're not from the system, you're from other country, you don't know how using specific words would impact the other person, or how
True.
using specific lines would affect the other person. What are their expectations out of you?
True.
Try to practice with somebody from US. That would really help you.
Excellent. I think that's pretty much wrap up all the main questions, right? We're gonna play the this and that. So I
Okay,
prepared
sure.
two type of this and that. This is just for entertainment only. But there are two topics, this and that. One is the USMLE residency related. The other one is more like a personal stuff. Let's start with the medicine part. UWorld or Emboss?
UWorld any day.
Digital note or physical note?
Digital note any day.
Type or write?
Type for the most part.
Tutor mode, time mode?
Timed.
UWorld self-assessment or NBMB?
NBMEs.
Pass fail or 3-digit score?
3-digit score.
3-digit score.
Yeah,
so
definitely.
You prefer like step one to be a 3-digit score rather than a pass fail?
Of course. Of course.
Cool. Great. Single pass or 2-pass?
Single pass any day.
Flashcard or no flashcard?
No flashcards for me.
No flashcard. Inpatient observership or outpatient but hands-on?
Both, if you can.
If you can only choose one. So inpatient but observership or outpatient, you do hands-on?
Well, that's a very subjective question. What kind of outpatient clinic is it, or what kind of inpatient hospital is it? That even that matters, right? So try to diversify your US clinical experience. I would choose inpatient big hospital.
Inpatient big hospital. Excellent. Okay.
Yeah.
Now this is about letter of recommendations. Waive or not waive?
Waive.
Waive. Wow.
Yeah, of course.
You waive all of your letter recommendations?
Yes. That shows authenticity.
Amazing. Okay. That's very interesting. I waive all of my letter recommendations myself. I don't know, probably gonna edit this if not allowed to mention. But I actually like watch the videos in YouTube, USMLE Sarti, and they actually recommend not waive. So they said that it could be risky, you can lose your, I have a mixed feeling about that one actually. Yeah, maybe that's the case. But I think if you're confident, you know the attending, and then the attending will give you a good one, you waive.
Of course.
Right.
You get that feeling, right? When you're working with somebody and that person is impressed by you, you get that feeling that he's gonna write me a good letter.
Yes.
Right?
Excellent. Yeah. So this is about signaling. Do you prefer we have signaling or no signaling?
Good question again. I would say signaling helps. It does highlight your profile. So I think signaling does help.
Signaling.
But other than that, there should be a cap on interviews. So signaling with a cap on interviews, I mean, that would be a perfect solution. J1
or H1B?
I would have personally chosen H1B because there are different problems for Indians. But I'm getting J1 at only, so yeah.
Epic or Cerner? But I don't know if you used Cerner. I know you use Epic if you go to
I use both of them. Epic.
Okay. Pre-match or match?
Match.
Hospitalist or primary care? Maybe you haven't decided.
Primary care.
Primary care.
Primary care. Yeah,
Wow.
I would just
I
continue.
want to actually hear that. Zoom only give us 3 minutes left. Probably we need to extend because I want to hear the reason for that one.
I mean, I worked in a primary care clinic with a primary care physician, and I really loved the lifestyle of it.
The lifestyle. Got it. Yes, yes.
Yeah.
I can vouch for that because I work as primary care. This is during the submission of your application. Okay. Step three or no step three?
No, step three.
No step three. You don't feel like step
I
three
mean,
is
I mean, no, I mean, you are asking about my application or
no,
in
no.
general,
In
an annual
general,
application.
is it
Okay.
important to have
No,
step three when you submit the application, sir?
I would say yes. If you can, definitely go for it.
No, non-medicine part. Now it's more of like personal life stuff. Piano versus guitar,
Okay. Guitar.
soccer or
Yeah.
basketball,
Soccer.
coffee or tea,
Coffee.
window seat or aisle seat,
Window seat.
cats or dogs,
Both, but more dogs.
fiction or
You know,
non-fiction,
non-fiction.
comedy or thriller.
Thriller.
Whoa, interesting. What's your favorite one?
You, for that matter, it's a Netflix show. YOU, you.
I never heard that one. Netflix
Yeah.
show?
Yeah, it's you. YOU. That's a good one.
Oh, okay. I'm gonna check that one. All right. Morning person or night owl?
Night owl.
Winter or summer?
Winter.
I don't know if you play games, so I don't know if you're familiar with the terms. PC or console?
Console.
What do you play?
PlayStation 5.
Yeah, what do you play?
Assassin's Creed, Grand Theft Auto, Call of Duty,
Okay.
Age of Empires. That is a PC one. SimCity.
Cool. All right. Last one. Family or career?
It's I don't think that anyone can choose between those. A good balance of both. I'm usually a very ambitious person, but yeah, I like to balance it out.
All right. Perfect. I think that's pretty much wrap up the session. I really appreciate the session today. I think it would be very helpful for a lot of non-US IMG. I think they're having fun too. So I know knowing you
Yeah.
more. Right. Now
These were really fun questions, Dr. Yari. Thank you so much. It was really fun.
of course,
So
of
that-
course. Of course. Yeah, I will try to make it fun as well. Now I guess your turn. You have any question for me?
Any tips for the incoming intern year? Any things that I should keep in mind?
I think you can handle it pretty well. I always put it this way. In the first year, a lot of things that you learn is obtaining accurate information. That means you have
Mhm.
to learn how to take history well, because in the real, it's very different than USMLE questions, like very concise and USMLE. I mean, you've done observerships, you have done some hands-on, so they're all over the place. Patients will talk, going this way. You talk, do you have any chest pain? And then they talk, you know what, my son that time just graduated from, it's gonna be like that. And it
Yeah.
requires some skills for you to take a proper history without actually getting distracted and still get things done. So I think that is the first year. What you really focus on, getting the information really accurate and correct and presented to the attending the most accurate way possible. You need to know your patients. If you really know your patients, they're very happy with you. I think this is gonna change. The old thing is that you want to learn also how to write notes properly that gives accurate informations that will be helpful for documentations and also for other people that read the notes. But I think that's going to change because of AI.
Yeah.
So
Yeah.
I'm gonna make a video about this because I just started using AI documentations about 3 days ago because Massachusetts
Okay.
General launched AI documentations using abridged notes. It's very amazing. I was like surprised, like really, really amazed with the quality. I mean, I have conversation with the patient and then that's it. It creates notes for me. I copy paste it
Oh,
and then
really?
done. Yeah.
What is the name of the application? If you could help me with that.
Abridge. ABRIDGE. Average. But you need to have it on institution. You can't have it in your own.
ABRIDGE. I'm asking because I was working with a friend and we worked on a similar software that you
Oh,
just talk to the patient and it just creates a
it creates
note like that.
automatically. Yes, yes. So it saves a lot of,
Yeah.
but it's not exactly saves a lot of time for me. Maybe a lot of people will say that it saves a lot of time for them because I'm originally a very fast typer. I type as I speak to the patient. I can type without looking at the keyboard. So I just talk and speak, and then once they're done, I just summarize everything make it very concise, and
Mm-hmm.
send. I only take 5 minutes to make my notes in outpatients very, very quickly. Inpatient will be different. Patient will take time to write all this stuff, but outpatients very quick. So it's not about that the speed for me, but it's about it's a better note. The grammar and everything is correct. So it will change in the future. Maybe in your era, in the second or third year residency, you just
Yeah.
speak to the scribe, and then it will automatically create the notes. But yeah, if it's not, then you try to make good notes. Now second year, you start to manage the patients, do some very micro management, and learn how to do that. The main tips here is you kind of a little bit shift from when you do the USMLE stuff, you focus on knowledge, but when you go to residency,
Mm-hmm.
you focus on skills. You're obtaining skills,
Right. Right.
right? Skills
Mm-hmm.
of history, skills of physical exam, skills of being empathetic to the patient, skills of communication with patients, with their family, with the nurses, with your other
Mm-hmm.
colleagues. You just really needs to sharpen your skills on these areas. Interestingly, I found that the more you are more advanced, the more fundamental it gets. There will be a lot of things that you do understand. Guidelines are guidelines, but
Mm-hmm.
you have to individualize treatment. That's also another thing. You will learn how to individualize
Mm-hmm.
diagnosis, individualize management. That is beyond up to date. You're gonna learn beyond up to
Mm-hmm.
date. I'll share you one of my experience when I was doing my residency in nephrology. So this, I rotate with this doctor. Right, he is actually my favorite attending. He is very smart. Dr. Burns,
Mm-hmm.
nephrologist. I have to come like 4 a.m. in the morning, examine everybody, finish the notes before he rounds, and then we round. After the round, he write his notes, and as he write his notes, we round all the people, right? And then he's gonna ask me questions. There's this one patient I remember. He was an SIADH patient, 70 something years old, admitted. Okay. And then he asked me, what do you want to do? I was thinking, well, it says IADH, right? So you're going to put a fluid restriction. The sodium is not that bad. I mean, 125, 124, I can't really remember. And then he said, wrong answer. And then he turned to his computer. He typed 3% normal saline for SIDH.
Okay.
And then he turned to
Okay.
me. And then he said, your answer is the same like answering up to date, like in the answer up to date. You disconnected with the patient. That's what he said.
Mm-hmm.
Mhm. You know
Okay.
why? Because the patient has
Mm-hmm.
femur fracture. They have low sodium, and you want to optimize
Mm-hmm.
the sodium before surgery. If you do the fluid
Mm-hmm.
restrictions, it's gonna be slow and unpredictable. That's why he chose the 3% saline. That's
Right.
why he said you disconnected with the patient, because the answer is up to date. If you're SIADH, that the answer is fluid restriction. And he said that
Right.
if we do it your way, I'm gonna stay here until Christmas. I don't have time until Christmas. That's what he told me. But I learned a lot that day. That is individualized treatment. You see, the answer of SIDH is not always food restriction. It's not.
Restriction.
Sometimes it could be 3% saline. Sometimes it could be urea. Sometimes you can give
Yeah.
tolfenprid. So it really depends on the
Mm-hmm.
situation, the patients. So this is what you need to learn during the residency. So you need to use your brain and get more fundamental rather than going to guidelines and this is the answer. If you give
Yeah.
fluids, for example, for contrast, like gonna have contrast, you're gonna use fluid. How much fluid
Mm-hmm.
you need to give? The answer up to this is 1 cc per kilo, right, per hour.
Mm-hmm.
But that's not always the case. What if the patient's a little bit overload? What if the patient's more dehydrated? What if you start with 1 cc,
Yeah.
but you individualize and see how much the patient's actually needed, considering all the factors. This is something you're going to learn in residency. So that's why I said the more advanced you are, the more fundamental it gets, because your
Right.
pathophysiology and understanding and connecting with the patients, the situation of the patients, all matters. Choosing antihypertensive medications. If you say diabetic, yeah, you give lysin, ACE inhibitor or ARB. Not
Mm-hmm.
always. What if there's history of hyperkalemia? You know, yeah, it gets more fundamental the more advanced you get. So learn the skills, not just the knowledge, and then learn how to individualize treatment. And yeah, I think that would be my tips. So,
Well, thank you so much for such a great advice. I am really looking forward to residency now. Really
yeah,
excited for it.
I'm pretty sure you're very excited for it. So, all right, well, let's wrap up our session. Again, thank you so much.
Perfect. Thank you so much, Dr.
You're very welcome.
Haryadi.
Yeah, bye now. Take care.
Bye bye. Have a good time. Bye
You
bye.
too. Bye. Thank you for watching. If you found this video is valuable, please click like, subscribe, and share it. And don't forget, I just want to remind you that I have two gifts for you today. You can find it in the link description below. I have free online USMLE test taking strategies that I created myself after thousands of hours of USMLE. I got a lot of great feedback from students that have been using that and found that very, very valuable. Again, it's free. Just take it, grab it, and improve your score right away. And then the second thing is my free USCE guide for non-US IMG, where I provide information about types of USCE, where you can get USCE, how to get USCE without using a third-party agency, accommodation tips, code email template, and many more. It's free, and again, it's provided in the link down below. Again, thank you for watching, and I'll see you again in the next video. Bye.